Eye, and all these fun ones like that. And they can create a lot of tension headaches for patients, so this feels really good in any of your patients that have tension headaches. Even in patients with TMJ problems, sometimes this helps them with this. So this is a great technique. And just for any of your patients with neck pain, even if they don't have headaches, sometimes they just have a lot of tension just up here too. And this is a great relaxation technique for any patient, I would say, with any type of neck pain or stuff like that. So basically all I'm going to do is I'm going to create more of a lumbrical grip, kind of like this. And I'm going to apply that right here where the occiput meets those C1 area, okay? Kind of like your subxipals are right here. So just right underneath the base of that skull, I'm just going to kind of put my fingers in more of this lumbrical grip and just kind of let her head and the neck just sit kind of right on there. And then as I feel some of that soft tissue just releasing, she'll just kind of sink into my fingers. After I've, let that sink into my fingers for 2-3 minutes or something like that, you can just go ahead and create a little bit of a traction, a little bit of a distraction force. And you'll be able to feel, some patients, if they're really tight, they might not really relax that first time. It might take 5 minutes and you just maybe hold them there and don't do too much traction. Then as patients start to release, you can kind of do a little bit more tractioning. So you guys might not be able to see this very well, but ask me if you have questions on it. So all I'm doing is usually I'll have them on a pillow or I'll just support them. And I am just going to go ahead and just let her kind of sink into my fingers and just almost create a little bit of a distraction, almost like a little bit of a nodding. Okay? So I'm almost pulling that soft tissue away. I'm not really leaning back and pulling the head or the neck out. I'm almost creating a little bit of a nodding type of thing, if that makes sense.
When I see this done in the clinic, oftentimes the therapist is seated with their arms kind of extended out and that head is dropped. The head support on the table is dropped.
Oh, okay. I tend to do it more in a neutral position and let the patient sink back into me because I want them to be able to relax, and I feel if their head's off the edge of the table, they might not be able to relax, and I can't hold them like this on the end of my fingers. But I mean, if that's effective for you guys, everybody's gonna be a little bit differently. I just don't have very big hands. So I tend to do it in more of a neutral chin bias. A lot of times if you're in cervical extension, you're closing down on the vertebrae. And that's not a very comfortable position for some people that have like arthritic conditions or have, types of problems like that. But, if that's the position of comfort for your patient, I don't know.
Do you like to
usually tend to do
stand,
this in a
though?
certain
The only
position?
time I drop the end of the table is if I want to take them into extension.
Okay.
If for some reason it doesn't have it on, but if I want to take them down into extension, I'll do
That's
that.
the only reason
But
to do it.
I will tell you, like Sarah's saying, she's holding her fingers like this and the head is resting on her fingers. So all her job is to hold her fingers here and the weight of the head sort of applies the force. But you sit there for, I think you said up to, I'll hold it 3 to 5 minutes.
Yeah, I will.
And that gets tiring after a while, so if there's nothing supporting my hands, I think it's brutal. So I like to be where Sarah is, where my
And
hands
most
are on the
therapists
table.
sit, I stand. I mean, like I'm a stander all day long. So most people probably